We're one of the largest fellowships in the country, which means you get to really see a lot of that bread and butter pediatric dermatology, the things that every pediatric dermatologist sees in their practice day in and day out, as well as those highly specialized clinics, complex patients, really sort of putting together those very common diseases, as well as the really rare presentations of things, rare diseases, and managing those complex patients. I'm Lacey Kruse, and I'm the program director for our Pediatric Dermatology Fellowship at Lurie Children's. One of the things that I love about working at Lurie is that in an average day, I can see everything from the most benign appearing nevus or molluscum or warts, those really common entities that any pediatric dermatologist might see, to much more complicated, rare diagnoses.
Given our setting in a large metropolitan area like Chicago, creates for a lot of diversity, very high volumes. We see around 20,000 patient visits per year. Our patient population is extremely diverse. We have multiple cultures and ethnic backgrounds. Skin disease really can present very differently based on your skin type. So disease in a patient with very fair skin versus a patient with the darkest skin of color might look very different. There are also differences even in the genetic predisposition to maybe other disease associations. And because we practice in a city and in a hospital and in a department with such diversity, fellows who train in this program will really get to see all sides of the same disorder. Hi, I'm Dr. Tony Mancini. I'm the Division Head of Dermatology at Lurie Children's Hospital, and I'm the Associate Program Director for the Fellowship Program. In our program, fellows get to rotate in busy clinics. They get to do consultations both in the hospital, but also in other outpatient settings, like the Pediatric Emergency Department. Our fellows also get a fair amount of didactic exposure. So that includes things like a monthly journal club. We have a monthly textbook review. We even have twice yearly a nighttime meeting, which is called the Midwest Pediatric Dermatology Club, where we invite the other 6 training programs in dermatology in the city of Chicago to bring interesting cases, and we have dinner and just discuss those together. Our trainees also get to see how lifelong learning is really the basis for our specialty, as with many medical specialties. We have a monthly divisional care conference where all faculty trainees attend along with our nurses, and we show each other cases, and our trainees really get to see that even for those of us who have been doing this for decades, we always need help. There are times when we need to reach out to one another and put our heads together and get a consensus on either a diagnosis or the most optimal treatment plan for our patients. So our fellows really get to observe that kind of collaboration and those interactions in detail as a trainee in this program.
At Lurie, we have a commitment to diversity, equity, and inclusion, both for our faculty and for our trainees.
We have a real commitment to increasing representation and diversity within our faculty ranks, within our nursing and office staff, and we really appreciate the diversity that we all get to witness in the patients whom we serve. The person who's going to succeed best in a program like ours is the one who loves this field, who loves pediatrics and dermatology, who's engaged for a career of lifelong learning. We treat our division more like a family. We're all there for one another, and we hope that our trainees feel the same way. There's a lot of camaraderie within this division, and we all really enjoy what we do and enjoy coming to work each and every day.
When a fellow leaves our program, they're equipped to do anything from starting a private practice to maybe joining a private practice to becoming a leader in their field in academic pediatric dermatology. We have trained more academic pediatric dermatologists than any other program. It's one of the strengths of our program is that really strong academic training. And so I think no matter what the fellows' career goals are, we can help them strive to meet those goals. Thank you for your interest, and we hope to hear from you soon.